Hi, Sandia. I see you've joined us. Would you like to do a microphone test?
Yes, can you hear me? Good morning.
Good morning. I can hear you. Thank you.
Thanks.
Good morning, everyone. This is the clerk with a courtesy notice that this meeting is now being streamed live on the internet.
Hi, Susan. I see you've joined us. Would you like to do a microphone test?
Yep, I'm here.
I can hear you. Thank you very much.
Thank you.
And Carla, I see you've joined us as well. Would you like to do a microphone test?
Yes, good morning.
I can hear you. Thank you very much.
Great. Thanks.
And Vice Chairperson Ellenberg, I see you've joined us. Would you like to do a microphone test?
Good morning. Happy Friday.
I can see you and I can hear you. Thank you very much.
Recording in progress.
Morning, Rob Coelho doing a mic check.
Morning, Rob. We can hear you. Thanks.
Good morning, Roberto Mendoza with Facilities and Fleet.
Hi, Roberto. We can hear you. Thank you.
Good morning, Colin. This is Rosia Luna. Can you hear me?
You're loud and clear. Thank you very much.
Thank you.
Madam Chair, we are ready when you are.
Thank you very much. Good morning, everyone. I hope everyone's doing well. This is our December 17th meeting of the Children, Seniors, and Families Committee. We have a really big agenda in front of us today. Lots of really great work. We're so grateful to all of you. We're going to do roll call, then go to public comment. So if there's an item you'd like to speak to that is not on the agenda, but within the purview of the committee, this would be the time to raise your hand. Then we'll go to consent calendar and then reports. So with that, I'll ask our clerk to call the roll.
Good morning, Vice Chairperson Ellenberg
I am here.
and Chairperson Chavez.
Here, thank you.
Thank you.
We'll now go to public comment. And this is to speak to an item that is not on the agenda, but within the purview of the committee.
Our first speaker is Kathleen King. I'm unmuting you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Thank you. This is Kathleen King from Healthier Kids Foundation, and I am not quite sure which item I ever fit under, so I'm going to do it in public input. Healthier Kids Foundation now has 13 programs, but I plan to just speak about 3 this morning. We have their vision, dental, and mental health. We've screened, as of Monday, 9,733 children for vision. And of those, 19.46% received a referral to go to an optometrist, which is a 44% increase over pre-pandemic results. We expect to screen 16,000 this year, which creates 3,600 vision cases with 2 visits each, 7,200 visits. And we just can't get enough children into optometrists right now. In mental health, this year we have our wellness screening with physicians. We've screened in Luther Burbank, Franklin McKinley, and Campbell for a total of 1,256 screenings, with a plan to screen at Alum Rock, Morgan Hill, Rocket Ship, and Gilroy for a 2,500 this year. Our results are 2% are imminent need and go through the school protocol right then, and 47% borderline. Almost half the students have some major needs, and we still have 3 school districts to go. In dental, we've screened 8,317. We plan to screen 16,000. Some schools, we're actually seeing more than 50% get a referral for major cavities, pain, or infection. And right now, the average is 40.65%. We expect this will generate 6,600 dental cases this year. And each child takes 3 to 5 appointments. That's 24,000 visits this year. And we just can't get the kids in. There's just not enough available dental care, vision, and potentially mental health as well in the underserved districts we work in. We feel it's a perfect storm that needs much collaboration more than ever, and we appreciate Santa Clara County Board of Supervisors, Santa Clara Behavioral Health, SCCOE, the districts, FQHCs, and nonprofits all collaborating together. We appreciate any help you can supply to expand the amount of care for children. We believe all of these add to chronic absenteeism and affect the educational abilities of those that we serve. Thank you very much.
The next speaker is Court Watcher. I'm unmuting you. Oh, I apologize. They are using an older version of Zoom, so we will not be able to take comments from Court Watcher. I'm going to lower their hand. Next speaker is Laura. I have unmuted you. Please accept the unmute. You will have 3 minutes to speak. The timer will start when you begin speaking.
Good morning, everyone. My name is Laura Champion. Thank you, Supervisor Chavez, Supervisor Ellenberg, and the Committee, Children, Seniors, and Families for addressing a very important topic, and school absenteeism and behavioral health services in schools. I apologize, I was traveling yesterday. But I want to take a moment and let you know that I've been a marriage and family therapist since 1995. Many of you know me as the executive director previously of Uplift Family and Children's Services. In spring of 2019, I opened my own consulting firm, Champion Consulting Services, LLC. One of my first projects was with the Healthier Kids Foundation, the prevention screening in schools for fifth graders. It's entitled My Health First. And it is combined with the physical health screenings. Eventually, they'll all be together. And that's in alignment with the Federal Substance Abuse and Mental Health Services Administration's report published in 2019 entitled Ready, Set, Go Review, Screening for Behavioral Health Risks in Schools. The SAMHSA highly recommends that behavioral health screenings need to be combined with physical health screenings, just like the Healthier Kids Foundation has been doing for years, in order for it in schools, in collaboration with so many partners, in order for us to really, truly keep children from falling into the deep end. So yes, it'll contribute. Feds have said they'll contribute to children attending school, but being ready to learn as well. So it's been my pleasure to be the consultant on this project since January, I think, of 2020. And I was astounded to see not only all of the wonderful collaboration, behavioral health departments, school districts, Healthier Kids, first five, wow. The family resource centers, everybody has come together, full support from all of you and the Board of Supervisors. There have been private funders as well, and good thing. So in the pilot, in the Franklin McKinley School District, in the first year, 375 children and their parents who were in focus groups said, yes, please ask our children how we're doing. And we found out a lot. We did find out that there were children that had mental health needs, but we also found out those families are struggling for basic needs. And the Healthier Kids Foundation, in collaboration with so many others, got those mental health needs for those students and got those basic needs met for families right smack dab in the middle of quarantine. And now here it's expanding to all these other districts. You heard Ms. King talk about how many children have been through this already in just 3 districts, and now it's expanding to more. So here's my recommendation. Could you please analyze this model more as this committee and find out why it's so successful, why parents are saying, yes, please, find out from our children how they're doing and help us meet our needs. So thank you very much for looking at absenteeism, mental health services, close to my heart. Have a beautiful day.
Next speaker is Lisa Little. You have 3 minutes to speak. Please go ahead.
Thank you very much, supervisors. I am wanting to talk about the CEDA ordinance recommendation that was approved by the Commission on the Status of Women on November 8th. And then due to the cancellation of November's meeting, I thought was going to be on the agenda for today. And I understand and respect that there is a very full agenda, especially in light of the cancellation. But I want to urge you to give high priority to the now expired ordinance with the CEDA task force, and understand with CSW's recommendation that we have recommended that County Council prepare an ordinance, this new ordinance, to codify the county's commitment to locally adopt the spirit and underlying principles of CEDA, which is the Convention on the Elimination of All Forms of Discrimination Against Women. And we want that for the sustainable future without a time limit, as the task force was limited to just 3 years. So we currently, as a county and a leader in women's rights and rights for girls, do not have an official ordinance on file. And I understand that County Council decided to withhold it, and I'm not sure what they're doing with it, but I thought that we were going to at least have it approved by your committee and then make a recommendation to the Board of Supervisors to move forward to have County Council prepare this ordinance. I want to emphasize that the gender analysis, the data collection that's routinely used to assess operations, including our policies and programs, services, and even budgets, is really critical. In fact, to have this analysis prepared not only within the county, but also with the support of an independent third party. That's what CEDA convention recommends. And that's the Commission on the Status of Women would be designated as the oversight body for the ordinance, and working closely with Office of Women's Policy and DESJ to administer the implementation of these recommendations, some of which you have already approved back in June. So I know that we have on consent the other recommendations, and I'm really hoping that we can begin this, or we can get the ordinance done so we can start regular review of county programs, policies, employment practices, budget allocation, and the provision of direct and indirect services, and that this new ordinance be fully inclusive of the LGBTQ community, communities of color, and people with disabilities. I really appreciate you giving this high priority and making sure that it's on the agenda beyond the consent calendar for January. Thank you very much.
Next speaker is Susan Bassey. You have 3 minutes to speak. Please go ahead. Susan? Susan, you're unmuted, but we can't hear you. We'll come back. The next speaker is Raimundo Espinoza. You have 3 minutes to speak. Please go ahead.
Good morning. This is Raimundo Espinoza, Gardner Health Services. I just wanted to, in support of what Kathleen said about the need for dental services and other services, actually, we're providing services. We're seeing about 50 to 60 patients a day, and right now new patients can't be seen until March, and the follow-up for the existing patients will take up to 9 weeks. So we're definitely inundated with the need, but don't have the capacity to grow at our existing sites. And I think if there's a possibility to identify opportunities to grow, that would be great, because the need is so great. In addition, our mental health units have gone, I mean, we're like at 110% when whereas in pre-COVID, we were like 80%. The need is also great for mental health services, especially during this period of time during the holidays. And it's been really an issue of access, because people have been accessing it more because of telemedicine. And so again, I just want to appreciate this opportunity to talk about the need. And thank you, Supervisor Ellenberg and Chavez, for listening to our concerns about the need for dental services and other services for children, seniors, and families.
Next speaker is Scott Largent. You have 3 minutes to speak. Please go ahead.
Thank you. Good morning, everyone. Scott Largent. In the on KTVU News yesterday, they did a piece on homeless encampments in Santa Cruz behind the Santa Cruz County building that have been getting flooded, and they had some drone footage. It was pretty shocking to see everything, but it was not nearly as bad as what we have going on right near our county building right now. It's not drying out over here after the last storm, and it is now turned into like one of those Tough Mudder competitions. And all you hear is just these revving of these engines and people trying to maneuver themselves out of it's a mud pit. A lot of people have to get to work here. You know, this is not just a bunch of people that just sit around and don't do anything all day long. I'm not sure if any of you are aware, a lot of people out here actually deliver your food. A lot of them work for DoorDash and a bunch of these other places. They get on the little scooters, they use their EBT card. They go over to one of those mega kitchens that's right across the street here, and they pick up food and they deliver it throughout all these storms and stuff like that. So they are working. Half of the homeless deaths that came out yesterday were seniors. That's very shameful. These people need help now. And we had a mayor in Santa Cruz, and I was very impressed with what she did. She basically got out there on that podium, got out there with the press and said, this is a disaster right now. These people need us now. You know, get the resources out there. This is a situation that's going on here right now. People are just shivering cold, standing out there in mud. It is sad. It's very, very sad. Sun came out today, but it's still going to be just a lake out here. Is there any way we can get the Valley homeless healthcare buses out here? I mean, we have a certain schedule, but this is kind of a disaster situation right now. Can we dispatch those buses? Can you send that text message, Cindy? Susan, can you do the same thing? Can you just start lighting the fire under these people? Because what's going to happen is a lot of people out here are going to get hypothermia. They're going to end up Valley Medical Center, and we're going to have to spend hundreds of thousands of dollars to take care of somebody that we could have, we could have done the proactive thing. Let's get ahead of this right now. Please, I don't know what else to say right now other than, please, these people need your help. Thank you.
We're going to go back to Susan Bassey. Susan, I've unmuted you. You have 3 minutes. Please go ahead. Susan? I'm sorry, Susan, if you're speaking, we can't hear you. We'll give it another second and see if she can connect. Unfortunately, Madam Chair, it doesn't seem like Susan is able to unmute so we can hear her. And the only other individual who has their hand up is Court Watcher, who has an older version of Zoom and will not be able to speak. So that concludes our public speakers.
Thank you very much. And I do want to thank all of our public speakers. As a reminder, if you've spoken on an item in public comment that's actually on the agenda, you won't be able to do that again later in the meeting. And so with that, I'm going to ask for us to review the consent calendar and changes to the agenda. Susan, I wanted to see if you had any changes to the agenda or anything you'd like to put on or take off consent.
I do. Pardon me. Thank you very much. I would like to recommend for consent items 7, 10, and 11. And I have some additional comments. For item 10, which is the medical and dental examinations, I'd like to ask that the next quarterly report provide statistics on the CWS CMS backlog and progress to clear this backlog once the new process with DFCS and Healthier Kids has been implemented. Item 19 is the CSFC work plan, and I have just a couple of requests. On Monday, the board received an off agenda on work within the VMC pediatric care clinics to embed screening and supports for families using the Healthy Steps model in response to my November 2020 referral and building upon prior health system work by Supervisor Yeager on universal screening. This work is distinct from the specialized services of the Center of Excellence, but also ties into how our health system provides behavioral health services and trauma responsive care for families and young children in our system. I'd like to ask that quarterly progress reports on the implementation of this model of care be included in the fiscal year 22 CFSC work plan, possibly on the same cadence as the Center of Excellence reports, to address any areas of coordination and to monitor the parallel progress. Second, I'd like for us to receive a quarterly status report on child care for county employees, starting with the first report for the January CSFC meeting. I've frequently asked about the status of this and noted yesterday that this is an accountability and transparency moment for us. Item 24 is the
Susan,
second.
can I go back? What was the last item number you were speaking to?
That was item 19.
Thank you.
The work plan.
Thank you.
Item 24 is the Second Harvest annual plan, and I just want to thank and acknowledge the tremendous response to increased community need. The report notes, this is a quote from the report, during the last fiscal year, we provided food to approximately 500,000 people across Santa Clara and San Mateo counties every month, with a total of over 140 million pounds of food distributed, enough to provide 110 million meals. Reading that literally made me gasp out loud. This is double pre-pandemic levels, and the need is expected to continue into the future. Second Harvest is really just an unbelievable resource to such a foundational need for our residents. Item 28 is our semi-annual ledge report. Thank you to Danielle Christian for the work on our IGR. I want to just take this quick minute to celebrate the signing of AB 1294 by Governor Newsom, of which our county was a co-sponsor. This bill extended the sunset date to July 1, 2023, the individual subsidized child care pilot for Santa Clara County. which provides local flexibility to allow existing funds to be fully utilized for the benefit of kids and their parents for childcare. Item 32, which is to receive a report from the Office of Women's Policy relating to the implementation of the prioritized recommendations of the Convention on the Elimination of All Forms of Discrimination Against Women Task Force, CEDAW. I want to thank the CEDAW Task Force for their recommendations and for the work that they've done to study and analyze issues impacting women, girls, and gender expansive individuals relating to housing, economic development, justice system involvement, gender-based violence, and leadership development. I also want to thank the Office of Women's Policy, in particular, Julie Ramirez and Laura Kim for all of their hard work in creating this implementation plan and gender analysis framework tool to assess county operations from a gender perspective and obtain feedback to improve the quality of county services. Item 33 is the quarterly school link services report. Thank you to staff for the report and for significant progress in the last 4 months. I'd like to see reports this school year provide detailed information on the utilization of augmented services, especially crisis response services, to monitor utilization and scale up or down as needed to match district and student needs during this unpredictable school year. Item 34 is the out-of-home placement annual report. I want to thank Director Dan Little for the department's work on updating the tracking of youth eligible for the San Andreas Regional Center services, as I previously requested. Thanks, Dan. In particular, I'm referring to the data for those children between birth and age 3 who qualify and are within the jurisdiction for early start services. The report notes that DFCS will be ramping up referrals for the Visiting Public Health Nurse program to support home visitation, and I am looking forward to seeing details on the success of increasing capacity in this program and the potential success of our home visitation program. So those are all of my comments on consent, and again, as a reminder, I'm recommending that we add 7, 10, and 11 to the consent calendar.
Thank you, Supervisor Ellenberg. I'm going to I wanted to make a couple of comments on item 7. This is housing and childcare. I'd actually like to recommend that that does go on consent, but that we have a report out in our February meeting on progress for this body of work. I want to stay, and the reason really is I just want to stay on top of the progress, but also to better understand prior to the budget process if there needs to be any further action relative to that. On item 10, I think that given just the feedback that we had today, I think it's appropriate to put it on consent as well. I do want to just add that the question that we're getting asked is really one about capacity. And so what I'd like to ask staff to do is respond back in the March committee meeting on what our capacity is and what the delta of capacity is. You know, I heard folks say that they wanted to give feedback on that item, and I just think that the only way to do that is really to understand the gaps as best we can. So if that can come back to us in March, I think that would be great. I think I'd also, Supervisor Ellenberg, be comfortable putting items 9 and 13 on consent as well. And let me just read some comments into the record while you take a look at those. And to the staff, one recommendation I'm going to make both from Supervisor Ellenberg and I, because of our comments are varied over a number of issues, I'm going to ask both of us that if there's any comments that we have in writing that make it easier for you in the minutes, that we get those, we'll ask both offices to get those to you. So with the addition of 9, this is our quarterly update regarding our welcoming center. And I'd like to request that this remains on the committee's work plan on a quarterly basis. And when the next report comes back, that it include the following: timelines, work plans, next steps, and status updates on the evaluation process of the welcoming center, as well as discussions on how to bring the services in-house, and just to better understand where our staff is on that, given that the board gave direction, and I'm not sure if the staff is in the same place as the board, so we should just have that discussion, including the relocation of the Welcoming Center at the Children's Center of Excellence at the O'Connor site, which I now know has a new name. So I'll try to get that right. On item 11, this is to receive the annual report from the Social Services Agency on the Department of Aging and Social Services on the IHSS in-home supportive services. I want to again say thank you to the staff for the report. And I'm hoping that we can continue to work on the Harvey Rose audit recommendations. And what I'd like to recommend is that we get updates on the trainings, improved efficiency rates, reduced wait times, and all the excellent work from the staff. I have read about a pilot program in San Francisco where IHSS workers are supporting unhoused individuals as they transition into permanent supportive housing by assisting with cleaning, cooking, and shopping. And I'd like to ask staff if you could take a look at that program and give us an off-agenda report again in the March timeframe about whether or not that's something that we can incorporate into our IHSS programming. Item 13 is a bi-monthly report on the hub. I feel like we're moving in a good direction. Want to thank the staff and want to just encourage the timing on this is so critical that we just want to make sure this stays on our agenda so we can stay on top of those actions. Item 17 is the approval of minutes on our November 5th joint meeting with the City of San Jose on gender-based violence and and child sexual abuse. And the committee gave direction to get several reports. I recognize that there's one report outstanding, and that's regarding the mandated reporting and our partnerships with the schools so that they deeply understand their responsibilities and the mechanisms for reporting. We've had some feedback from some schools that that's not been crystal clear. And I know, Dan Little, you and your team are working on this. I'd like to request that update come back to us in the first quarter of next year so we understand where we are in the training and process and whether or not, frankly, it requires training or just more clarity between us and some specific schools. And then on item 26, this is our summer camp program that's focused on foster youth. It has a funding life that goes through September 2022. I want to ask staff that this come back to this committee in March of 2022 with a recommended amount of resources to continue the program and to embed this in as a permanent part of the work that we do. On the, I think that, and let me just say one other thing, staff, I want to thank all of you for the just tremendous amount of work that goes into all of these reports. We, for the most part, are not pulling them off consent because they're clear. We're in alignment on direction, and so we're excited to say thank you for that body of work. And so anyway, I just wanted to just acknowledge all the hard work from all the leadership that's coming through here. We'll now go to public oh, I'm sorry, Susan, are those changes in alignment with yours? You're good with that?
They all are, yes.
Okay, great. So we'll make a motion from Supervisor Ellenberg.
So moved.
Thank you. And a second from myself, and we'll commit to give the staff all of our notes so that we don't make you crazy. And then what I want to just say is that I'm asking people on this item, we're going to do 1 minute. And if you've spoken on the item already, please do not speak again. But if this is on something new, we'd love to hear from you. Thank you.
One moment, please, while we get the timer adjusted.
Oh, I'm sorry. Yeah, whatever you had it at. I'm sorry, Dave.
Okay. The next speaker is Lisa Little. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Thank you very much. I just wanted to amplify and uplift the reports that are in the consent calendar from the Office of Women's Policy and the CDAW Task Force to highlight some of the priorities in the recommendations and make sure that they do get forwarded, sent to the full board of supervisors and get funding for the gender-based analysis that we recommend to apply to the supportive housing and all the different areas of recommendation that we have put in the reports. the gender-based analysis framework. And I want to thank very much Julie Ramirez, as Supervisor Ellenberg said, as well as Laura Kim for putting this together. But we really want to make sure that this gets attention. And I understand that it's clear in the reports, but making sure that it now goes to the board because this compendium is now complete. I understand that, some of these recommendations.
That concludes our public speakers.
Thank you so much. I appreciate it. And Lisa, thank you for your work on the commission and tremendous efforts there. Okay, so with that, we're going to move on to item, I'm sorry, we have to take a vote. Sorry about that.
Thank you, Madam Chair. Vice Chairperson Ellenberg
Yes.
and Chairperson Chavez.
Yes.
Thank you.
And again, thanks for all the hard work. All right, we're going to move on then to item 4. And this is the future for comprehensive RFPs. And Carla, I love your sweater. Welcome.
Thank you. Thank you so much. I'm going to share my screen really quickly. We are having a holiday luncheon right after this meeting. So let's see, is my screen sharing?
Yeah, we can see you, Carla.
Okay.
Perfect.
Great, thanks so much. Okay, so good morning. I'm Carla Collins, and on behalf of the Office of Gender-Based Violence Prevention, I thank you for this opportunity to share some of the highlights of the incredible investment our county is making to address gender-based violence. Let me just make sure I can move the slides. Here we go. Okay, actually, we're going to go quickly over this. So for decades, our county has been nationally recognized for our efforts to address gender-based violence, particularly in domestic violence. And many of you have been part of our advisory committees, the Domestic Violence Council, the Human Trafficking Commission. We had a Blue Ribbon Task Force on Intimate Partner Violence. We have the Sexual Assault Response Team, all these entities that have worked as part of the decision-making infrastructure to inform policy, protocols, and programming to support survivors of gender-based violence. And let's see, what has changed besides COVID in these past few years has been an increase in budget to match the work. And in fact, the office was established at the end of September 2019, less than 6 months before our county and the world started to shelter in place, in large part to oversee this budget. So consider that just a few years ago, we were really only funding our domestic violence shelter services, and that was at less than $500,000 a year. In 2017, we saw some additional resources to fund anti-human trafficking services. That started at less than $330,000, and by FY19 was just under $900,000. We've started funding sexual assault rape crisis center services. And in fact, this year, we are funding almost $15 million in ongoing and one-time services to better address gender-based violence in every district of our county with innovative, culturally responsive, and survivor-centered efforts, as well as efforts to address the whole family and those who do harm. This is all out of our general fund. So this slide here provides another snapshot of where the investments are. Direct services for survivors remains the priority and where over half the funds are allotted. But it is because we have better addressed the direct services that we have been able to create space to do even more. And as we've said, there have been many efforts underway before the office was even formed. So one of our first tasks was to map various funding cycles. And one of our first goals was to develop a plan to streamline the various contract cycles and align funding efforts. And this slide illustrates the concept of what we've labeled as a comprehensive RFP with services to be in place by July 1st, 2023. Now, this will allow completion of all our current contract cycles and the ongoing analysis of current service provision to inform a multi-category request for proposals. This RFP will be designed to better address client need for services by focusing on the services and not a siloed focus on the type of violence. So we believe this is a great path forward to increasing access to the highest quality services for all residents. It will also increase efficiency and ease for our contractors, which will allow them to do what they do best, their work. And we believe it will improve data collection and analysis and enable us to best inform decision makers with demonstrated evidence from the return on their investment. So of course we have incredible expertise at the table and fundamentally believe that everything we do at the Office of Gender-Based Violence must be done in partnership with our stakeholders. And a transparent competitive procurement is absolutely essential because this significant investment allows us to really transform our response to gender-based violence. Leading with data means that all of you will be able to make final funding decisions based on data that demonstrates not just outputs, but real outcomes in our community. We believe we will need to increase our prevention efforts to really address the root causes of violence. And I think of Desmond Tutu, who said, we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. And an investment of this size really allows us to transform our response and do this. So we will continue our work to reframe things like housing and economic empowerment, because truly this is also violence prevention. And we will continue our focus to bring culturally responsive, trauma-informed services to everyone impacted by gender-based violence so that we can take this path not just to survive, but to heal our community. So sexual violence, domestic violence, and human trafficking are horrific realities for far too many in our county, in our state, in our nation, in fact, in our world. But working together, we have the opportunity, at least right now, right here, to do better. So this concludes the presentation, and I'm available for any questions. And I also have Julie Ramirez here with us if you have questions. Thank you.
Wonderful. I'm going to first go and see if we have any members of the public who would like to speak on this item. And then I'll come back to the board. Thank you.
Looks like we have one speaker, Madam Chair. How long would you like to give them?
2 minutes. Thank you.
Okay, one moment, please, while we get the timer ready. Next speaker is Perla Flores. I'm unmuting you. Please accept the unmute. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Good morning. Thank you so much for this opportunity to speak in support of this move towards intersectional support for survivors of gender-based violence and really looking at providing robust and comprehensive services from crisis to long-term stability and sustainability. That's also coupled with a housing support and really robust support around self-sufficiency and helping survivors to be able to move past the cycle of poverty and of violence as well. So really grateful for all of the work of the Office of Gender-Based Violence Prevention and that our supervisors, particularly Supervisor Chavez, have done around this issue of gender-based violence. And also really excited to work together to, because there's several recommendations in the CDAW reports, particularly the CDAW report on gender-based violence and on housing that could be aligned and moving forward these efforts. So again, really excited to see us taking an intersectional approach and moving away from silos as we support survivors of gender-based violence. And also really excited to do this prevention work that's long-term and taking a public health approach that really looks at different forms of prevention from primary to tertiary. And thank you again for your support.
And that concludes our public speakers.
Thank you. And Perla, you in particular, I want to acknowledge and lift up. I think we have been talking about, frankly, a new way to structure contracts for 8 years. And you and Community Solutions and other nonprofits that have really been our partners have just been instrumental in helping us think differently. You know, I am really excited about the transition. I think it's the right thing. I think we've all been trying to move there, Carla, and you really got us there, you and Julie, so thank you. You know, one request that I have is that I would like to engage Jean Clark in what I think is really the next phase of the contract development and management. And Supervisor Ellenberg, one of the issues that has been underpinning, so there's the body of work that we're doing relative to all forms of harm, and recognizing that we often have victims that are multiply affected, and you know, and wanting to create more flexibility for our contract partners. And so one of the things, Carla, that I'm really interested in is the design of the contracts that allows for innovation and creates an environment where we are asking really hard questions about how the work we're doing is either effective or ineffective, without penalizing the nonprofit for being honest with us about why something is or isn't working. And specifically what I mean by that is that I want to make sure that we're building in the evaluations to create the flexibility for us as the contractor and our contract partners to be able to say, this is the route we were taking. We're finding that this doesn't work for this particular group of folks. We want to change it up, but that is done in a really collaborative way with still mutual accountability, them to us and us to them. And I'm recommending we bring Jean in because I think we have a really strong contracting team in SSA. And I think that we may want to, as you're making this transition, pilot with a couple of nonprofits that particularly have a strong back of house and have a strong history of the capacity to evaluate in real time, so that we're better able to manage contracts over a multi-year period of time, and that we're not trying to, well, frankly, that we're just creating the opportunity for more collaboration and really being able to serve the individual. And Supervisor Ellenberg, what this comes from is that, we are obviously we're the guardians of our tax dollars, and we want to make sure that we're making sure that they're spent well. But I also feel like on occasion we've structured our contracts in a way that create very little flexibility, and we're funding things that aren't working, and then we're telling people to tell us that they work. And so I'm really trying to figure out if we can get to a different place. And I think the Office of Gender-Based Violence, the social services agencies, really strong team could work with Jean to make sure that in the end, our partnerships are meaningful and we can quantify what works and stop doing what doesn't work without penalizing the nonprofit for telling us the truth. And that's really where I'd like us to get. I know Jean's not here today, but I will ask Paul in my office to work with Alex to get him just a summary of this discussion so that he's able to weigh in. I talked to him about this a while ago, but it's been a while. And then Susan, I'll go to you.
Thanks. I really strongly agree with that. It's a concern that I've been hearing from the nonprofits really since I joined the board. Thank you, Carla, for the report. I really appreciate this whole conversation, and that the Office of Gender-Based Violence is really working effectively to stream the RFP process so that we can increase transparency. Can you tell me what the source of revenue is for the approximately $15 million in RFPs that we do have available?
So currently it's all general fund.
Are there opportunities or options for there to be other sources that we could draw from?
I think there are some opportunities. We've been in communication with behavioral health around some of the federal funding. I think as we're working with the Office of Supportive Housing and with more closely around the sexual assault and some of the medical things with our partners over in Valley Medical, there's some potential funding to be bringing in. And of course, some of the funding that we've started that we're grateful that we're using to fund the rape crisis centers is really a state mandate. So still working with our legislative director to work with this other state partners to get more of the state.
Actually fund the mandates.
Right. So we have a lot of different ongoing efforts and some conversations about other streams of funding that might be potential to bring in. But right now, everything that I described in the PowerPoint is all general fund.
Great. Thank you for all of that. And I appreciate that you're looking at other sources. When you have some updates and hopefully have identified sources of funding other than general fund, would you please share that in an off-agenda report to the board?
Absolutely.
Thanks so much, Carla.
And Carla, two things that I think that's a really great point, Susan. Two things that I would like to recommend is that it may be of value to take a look at all of the work that we're doing in this area and the new resources that are coming online. Like I know the Light Task Force through Sharon Deneau's work just received a $1.5 million grant. I think the point that the work that we're doing on the all the way home or heading home, I can't remember, we name these things so closely to each other that I can't remember, but the resources we're using both in partnership with the Housing Authority and with our own work that we ought to build out the whole picture so that we can demonstrate how those partnerships are impacting our resources. The other thing too is that I want to be clear about something that I feel like we embedded in some action a while ago. And if we didn't, I want to embed it now, which is that as we are changing this process for contracting, to me, it is not optional that we have an evaluative component. And there are some obvious reasons for that, so I don't need to state them, but we are changing our approach, and we need to be able to say this approach has merit or it doesn't. And so when these contracts come back, I want to make sure there's an evaluation component in it. And I don't think we should think about evaluation. I mean, I think it should be third party and all that. And I don't think we should necessarily just choose the evaluator. I think that should be done with our nonprofit partners. Like, this should be collaborative all the way, but we're going to be making some changes, and I hope taking some very prudent risk, but that prudent risk has to come with evaluation. I think that's going to be really important. And then I'm interested in February with the evaluation component coming back, and I think was what Supervisor Ellenberg asked, what's the package, like in addition to general fund, what are all the other revenues and resources that we're using? And then just as a reminder, Supervisor Ellenberg, you may recall that when our joint meeting with the City of San Jose, we may actually have an additional funding obligation as it relates to paying for rape kits if we have to do that in the short run, because as we're working through our reporting and who's doing what with the City of San Jose. So Carla, I'd also like an update to this committee on where we are with that body of work. I know I forgot who's leading that, but I think we're just going to need an update before budget.
We can include that. Yes. Thanks.
Yeah, I appreciate it. Well, thank you. I don't have anything else. Susan, do you? Good. And Carla, thank you, and Julie and the whole team, and to our nonprofit partners. We so appreciate the work you're doing, and frankly, the lobbying you're doing. Oh, I know that's what I was going to say to Danielle Christian. The other thing I think we need to do is work with statewide partners to get the rape crisis centers fully funded from the state. That should be on our top, the top of our list. And just to be clear, they were never fully funded. So it's their responsibility, and then they completely underfunded them. And we now have, and this is why evaluation is so important, we actually know how much it costs to run them now. Like we can prove that. That's the kind of information we need to get to the state. And I know Supervisor Ellenberg is playing an incredible leadership role with CSAC, and we should talk to them too about it. It's actually criminal that we're not funding these statewide, because at least our county's leaning in and paying for them, and a whole bunch of other counties, there is no support, none. So anyway, for all that. All right, I don't think we need an action on this item. I think this was just a report with direction. And so I don't think we took any. I'll ask Rob. Rob, should we just take a motion on this given the amount of direction we gave? Let's just do it. Dave?
That'll work, Supervisor.
Yeah, thanks, Dave. You want to just.
I'll make a motion to accept the report with the added direction.
Thank you, and I'll second it.
Vice Chairperson Ellenberg?
Yes.
Chairperson Chavez?
Yes.
Thank you.
I had to think about my vote there for a minute. Just kidding. All right, we're now going to go to item 5, the Office of Children and Family Policy. I thought we were calling it advocacy, but Susan, I thought you named it something else.
Can you hear me okay?
Children's policy.
Yeah, there you go. Rocio, yes.
Yes, hi,
Okay.
good morning, Supervisors. Rocio Luna, Deputy County Executive. This item is a status report on the recruitment efforts for the Director of the Office of Children and Families Policy. Unfortunately, the first round of interviews held in October did not yield a candidate for this very important office. That said, we understand the urgency in filling this critical position, and we are working with executive services on additional recruitment strategies that include input from our many, many local partners and advocates working in this space. On Wednesday, this position was reposted to open recruitment and is now on the county website. With that, I'm happy to answer any questions or seek additional guidance from you.
See if there are any comments from the public. And I see none. So I'm going to come back to Supervisor Ellenberg. You know, my question is the organization positioned properly to get the caliber of candidates that you need? And I'm asking that, I don't, by position, I mean like in the organization, funding, all that. Do you, Rocio, do you have a sense of that?
You know, I have actually had a couple of conversations with a few of our stakeholders, including Dr. Dewan and others around, you know, maybe some perceived barriers with recruitment strategies. And basically it's partly timing. As you know, there are a lot of open sort of recruitments for very similar like positions locally and statewide. So it's a little bit of just some competition, a little bit of timing. But I think in the organization, it is actually at the highest level, reporting to Dr. Smith. And, you know, we will sort of reevaluate any potential additional considerations with ESA as we go out one more time. So I do think that we need to go out one more time.
Yeah, Rocio, is it a deputy? Is it a deputy? I'm not sure which, a deputy county exec?
It is not a it is not a deputy county executive, but it is, you know, on par, I believe, high enough in the organization to influence, you know, change and coordinate our systems of care.
Would that title, do you think, help in recruitment efforts?
It could, and it's something that we should reevaluate. Maybe it's the title may not be the best title, and so we could. There might be some confusion, of course, with DFCS, and of course we should look at that, and we will.
Yeah, I don't know that I would just we're not going to repost just the same thing, right?
It is reposted as the same thing right now as continuous, but at the same time we are looking at whether or not we need to make some changes to that. So it's open as continuous to see sort of who is applying. So it'll give us a sense also of, you know, what is happening with the recruitment as we look to make potential changes if necessary.
Do we have an outside recruiter helping us?
We do. I don't know if we do, to be honest with you. I can follow up and find out.
So Susan, here's what, do you have other ideas or thoughts besides, I mean, I think you and I are going to start recruiting people, but which, I mean, I did send it out, but I didn't, you know, or I sent a couple people to us, but
I'm concerned that the title of director sounds more like a mid-level role, and I'm not sure why we think we would get a different type of pool of applicants
with the same name,
putting the same thing out again. You know, making it clear. I know it says that the reporting is directly to the county executive, but I think really lifting that up, the importance and significance of this role, I think is important, and maybe thinking about some non-traditional avenues of promoting this opportunity.
You know, I see John Mills on, and Rocio, I know you're not in charge of recruitment, so let me turn to John Mills. I just realized we're asking.
We really want to find you somebody great. We are on your side in this.
That's right. So John, could you talk just, I agree with Susan. I think the director title is, I think it's a little confusing. And I didn't think about, Rocio, the point about having it look like the SSA director, you know, so I understand we might not, anyway. John, what can we do to make the title more clear and elevate and be clear about the role in the organization? Because I think in your world, I now understand the importance of an executive relative to a department head relative to, and director is down that list, right? If you're a director, you would be working for a department head, I would imagine.
Well, and thank you, Supervisor, for for turning to me in the conversation. And I've been reflecting as the conversation has been ensuing about sort of what possible options we might consider in thinking about the recruitment challenges that you all have highlighted in the conversation to date. From a classification perspective, a director is a department head. So all of our department heads are, director of department of such and such. So that I don't think is the issue. There may be something to the point that was raised about potentially confusion among candidates related to possibly Department of Family and Children's Services Director and, Director of the Office of Children and Families Policy, because those titles do seem somewhat similar. I'm just thinking now about, so yes, a title change is certainly possible. We can definitely reflect on this conversation and think about some possible options. And, one that occurred to me as you all were talking, as I was thinking about another convention that we have here at the county, if you look at, say, like the Chief Information Officer or the Chief Procurement Officer, is I'm wondering if one thing we might look at is something along the lines of like a
Chief Children's Officer.
Yeah, like a Chief Children's Officer or Chief Children's Policy Officer, something like that, that to the concern about elevating the title, that might do the trick, something along those lines.
Yeah, John, I think I think Supervisor Chavez and I had both liked the Chief Children's Officer at one point. I think also removing families from the title. I mean, obviously, children don't exist in vacuums. Obviously, this is for kids and families, but that distinguishes it more from anybody that's confused about the Department of Family and Children's Services. So I think somebody will look twice and say, oh, wait, children's policy. And it's also not services. If it's Deputy Executive Director for Children's Policy or Chief Children's Policy Officer, I think those can help elevate the title as well.
Yes.
And one other, and I just want to say too, John, to you and your team and Rocio, I really appreciate how seriously you're taking this, and that if you didn't find the right person, you're just going to find the right person. So I think we have a sense of urgency, but we don't want to rush you into a
non-ideal candidate.
Yeah. So don't take our urgency as what it is. And then, Supervisor Ellenberg, one thing you and I might want to think about is we may want to think about doing some sort of convening with all the folks who are invested in children around not just the work we're doing in this area, but also around this position, to get a lot of help and enthusiasm in the nonprofit community to help us find that person. Because I know
that we need to convene people for it, but I think certainly letting them know, resharing the job description.
And maybe even doing, taking the subject matter experts who helped and the interview panel to have them push it out. Because I think it needs to go out perhaps in a different way. But yeah, I hear what you're saying, Susan. That's probably a better way to do it. All right. Well, with that, Susan, did you have any other comments or questions on this item?
I don't. I really appreciate the update. Thanks, Dr. Luna.
Yeah, and I appreciate how both John and Rocio, thank you for hanging in there with us. It's so critical. All right, we're going to move to item 6, and this is the Child and Adolescent Center of Excellence with our new name. So anyway, Curtis, you'll help me. You're going to help me understand what name we're calling it and why. So I'm turning to you.
Thank you, Supervisors Chavez and Ellenberg. Good morning, Curtis Ohashi from Santa Clara Valley Medical Center. I wanted to speak briefly about the update for the Youth Center for Evaluation and Advocacy. A brief note on the name change. The prior name, acronym, the Children Adolescent Center of Excellence, or CACE, was thought to be very potentially confusing with our Child Advocacy Clinic acronym, which is the CAC. So in order to protect the branding of the CAC and to add a aspirational component to the name, we came up with a distinctive name, which is the Youth Center for Evaluation and Advocacy, which will be located at 455 O'Connor. So in my brief update on the Spark Clinic, we did have to change architect vendors mid-project, primarily due to attrition in their ranks. That coupled with the unanticipated availability of some additional space, we were informed by FAF that rather than a two-part process, as we were planning, that it would be more cost-effective to renovate all 3 spaces at the same time, and that would push our go-live date from July of 2022 to December of 2022. In terms of the update for the Pediatric Developmental Service Center, that opening date is still scheduled for July of 2022. What we're planning is a second round of stakeholder meetings in the month of January to further refine the vision and scope of services and solidify the staffing plan. And then shortly thereafter, we will be providing a staffing plan to your board with a request for additional positions. So that concludes my brief report, and I am available for any questions you may have.
Thank you, Curtis. I'm going to first go to the public, and then I'm going to come back to Susan and I.
One moment, please, while we get the timer up. Next speaker is Dana Bunnett. I'm unmuting you. You have 2 minutes to speak. Please go ahead.
Thank you very much. Dana Bunnett, Executive Director of Kids in Common. Good morning, folks. I'm very excited about this Center for Excellence, and just think it's really cool what's going on. I'm here to address a little bit, though, the lack of commentary in the child impact statement. And just want to every now and then remind us that these child impact statements can be really powerful tools in terms of helping us understand how the decisions we make impact kids. And while I know that this will have will benefit children and youth, it'd be great to hear a little bit about how it benefits children and youth in the impact statements. And this is not to pick on you, Mr. Ohashi. It's just, I've just been noticing kind of going through that some of them do lack a lot of context, the context that's really helpful, I think, in thinking about that. So just wanted to mention that, but I'm really excited about this happening, and thank you very much for the investment. Thank you. Bye-bye.
Thanks, Dana. Thanks. It's great to hear all these kids champions today. So on Curtis, just to come back, in September, we had a couple of requests that are not entirely reflected in the report, and I just want to do a kind of a check-in on them. One is that as we're looking at and doing the outreach with our partners, one request that I want to make is that when we do a report out at our next report out, that you're able to explain to us the integration where appropriate of our partners. So for example, if we have a nonprofit partner, how are they being integrated? What's their role? The same with the schools, because I think one of the incredible opportunities we have with these new approaches is really, acting like we're one agency, in terms of the response to the family and the child. So that's one report out. The second specifically that I wanted to better understand is how the design of all these partners being in one location reflects and helps to facilitate the connection between the children, families, schools, all those services they need. Like, how does the actual design do that? And I haven't seen anything on that, and I'd really like to. And then the other is that we are really interested. I think Supervisor Ellenberg and I have raised this with everybody who talks to us about a new building, which is, are we looking at and do we have the appropriate space for supervised childcare at these facilities? And I mean, we talk about it all the time, so I don't need to say why it's important. Curtis, I know you know why it's important. Mm-hmm. But I am really interested in understanding if we are going to co-locate childcare services here. If so, what kind? If not, why not? And one request, and I'm not going to make this of you actually, but when we wrap up this report, Miguel, one request that I have is that the county bring on a partner that can do the market analysis around childcare consistently for us, so that we better understand, some childcare, some programs are different and don't require the same level of understanding. But for example, the hub, which we talked about earlier, we are supposed to be doing an analysis of the needs of the users of the building, but also within the region as to whether or not childcare could survive there from could survive long term. But I don't believe we have a partner, and I don't believe policies come to the board from the staff that outlines that as a core body of work that we understand we're supposed to be doing.
Yeah, I definitely agree. We need to be data driven as we move this work forward. I'm not aware of what we're doing, but I can certainly look into it and agree that we need to be data driven in this work.
So perhaps what would be of value is to have a discussion, at the committee, but perhaps with Dr. Smith, yourself, Miguel, and Jeff Draper, because because even shaping that, like what I don't want Supervisor Ellenberg and I to be put in a situation where we're saying we're going to put childcare in every building. I think what we want to make sure of is that there's a complete analysis as we're developing our own, there are opportunities that I think we're passing up that I want to make sure we address. So if we in the January, February timeframe could even have a verbal update, and if we need to come back with a policy, I'd like to be able to discuss that with you and Supervisor Ellenberg all at the same time, and then determine how to bring that to the full board if board action is required. But what is concerning me is I'm not sure we have the framework, so we keep talking about it and creating a lot of frustration where maybe if we just agree on a plan. I don't know, Susan, who weighed in there, but I'll turn to you, Susan.
I think that she was a little annoyed. We need to bring in Dr. Dewan to those conversations because she's already done the mapping, and we know where childcare deserts are. She knows, not 100%, but where some of the significant need is. So let's start with that evaluation tool as we're looking at spaces. And then there are best practices in looking at surrounding where a childcare facility is contemplated, looking at the surrounding neighborhood in terms of both residences and businesses, the types that are there, the likely population. So there is a way to do this systemically and that's data driven. And I don't know if Dr. Whitgob just came on maybe to comment on that. You're on mute. And then I have a couple of questions for Curtis.
I apologize. I was stuck in a patient room. I can keep quiet, or if you have a 5-second summary, I can jump in.
Oh, Emily, we'll come right back to you. Just we're on the topic of childcare. Supervisor Ellenberg, I do think, let me just say, I do think we want to use the data that that is already available. I do want to just comment that as an employer and as a building owner, I think we are going to have a slightly different analysis that's required. Mm-hmm. So I do want to make sure that we get that information to our team, but I'm really looking at this from the building owner, operator, employer framework.
Yeah, and I'm not suggesting it's the whole answer. It's just a piece that we should be considering so that we're not starting from zero. Curtis, you asked, and we also know that I think Facility and Fleets has already provided potential spaces for us in a previous report.
At this location?
No, not at this location, at other locations. So I think really looking at this from a policy level is important. Curtis, can you expand a little bit on what you said earlier about a round of planning meetings in January with partners on the service model and staffing?
Yes, actually Supervisor Chavez kind of read my mind with the first two questions she asked about what the particular relationship will look like with some of our stakeholder partners, as well as what the design of the on-site versus rotational use of the space is going to be. And that's what we're planning for the agenda for the January meeting, is to vet out some of those relationships and to further refine what the vision and relationship looks like, as well as the schedule.
Great. And can you also share what the status of service coordination planning for the Pediatric Diagnostic Specialty Center looks like?
Yes, service coordination, I'm assuming you mean the navigation component of that. So there are, I think you're probably aware, a number of both existing and new navigation efforts that are occurring in the county. The work of the CAST is one example of that. And what we're trying to do is we're trying to work with all of the partners to be able to integrate our navigation efforts with all the existing and upcoming efforts in order to avoid duplication and to optimize efficiency.
Thanks, I appreciate that. And has a mechanism or a plan to elicit parent input on the plan been developed or implemented?
We're working with parents helping parents to help, because they have some experience in that space, to help us solicit attendees in order to develop stakeholder forums for that as well. So that work is in progress as we speak.
I appreciate all of that information. Thank you.
Thanks, Susan. Those are great questions. All right. And then Emily, I'm so glad you're here. Dr. Whitcup, you're kind of our North Star in a lot of this work. So thank you for joining us. I think just the only other thing that that I think would be of huge value is that Supervisor Ellenberg, I'll just share with you that prior to this meeting, I met with Curtis and Paul Lorenz to talk specifically about our partnership with the County Office of Education on this body of work, and wanted to better understand as we come back, in the January, February timeframe, both with the navigation process, but also with the referral process and what's happening at what location. I was a little surprised to learn that that there would not be exam rooms at the new facility. And so I kind of went round and round with Curtis and Paul trying to understand that because I had presumed that we were going to be doing much more work on that we would be doing exams in real time and really connecting people to families to those services. So I am looking forward, frankly, to better understanding all that level of detail. And so, Emily, I requested a meeting with you and Dr. Foreman in the January timeframe, so we could dig into that body of work. Okay. Thank you. Emily, were you saying something? I'm sorry. You're on mute. There you go.
I am so sorry.
So that's okay. No problem.
I failed COVID. Yes, I just remember seeing the date, the 10th of January. We have a meeting.
Excellent. I'm looking forward to it. Thanks so much. Thank you. And thanks for being here. I know everybody's so busy. Okay. So I don't think Supervisor Ellenberg, I think those are all clear directions, and I don't think we need to take a motion on that, but good. All right, thanks all very, very much. We're super excited about this. That's why you're getting all of our detailed questions. All right, so item 7 was put on consent. We're going to go to item 8, and this is regarding universal basic income. And I'm not sure. I know this report came a little late, so I'm looking at. All right, so why don't we just hear from you all, because I didn't have a chance to dive in to your report.
Thank you. Good afternoon. Melanie Jimenez Perez, Program Manager with the Office of the County Executive, and I'm joined by my colleague, Sandia Hermon, who is the Deputy Director from SSA, who is leading our research and evaluation component of the pilot. So I will take you through the slides somewhat slowly since this information is hot off the presses. But first, I just wanted to say good morning and thank you for the chance to give an update on this pilot. This pilot really kicked off in 2020, and at that time, the concept of providing payments to our vulnerable populations through a guaranteed income program without any strings attached was a novel concept. But since then, we have seen that the interest from community-based organizations, philanthropic organizations, and also other governmental agencies has increased. And I wanted to share that there are almost 100 pilots that are being planned nationally or that have started since we began, who are focused on guaranteed income. And those pilots are also highly concentrated in the state of California. And that is, a lot of them are taking place even before the state funding becomes available. So we expect that to increase once the state funding does become available. But here locally, we have Destination Home in the city of Mountain View that are in the final stages of planning their own pilots. And so this is exciting because this not only provides us with the opportunity to support those efforts, but to also look at other vulnerable populations that could benefit from this service and how this is truly moving the needle towards stabilization for our community. So one of those great examples that we have looked to many times throughout the process has been the Stockton Seed Project. And I want to spend a moment just highlighting some of the key findings that they have reported. They started in February of 2019 and completed in February of 2021. They were initially scheduled for 18 months, but extended to 24 months given the global pandemic that started in the midst of their pilot. And just in March of this year, they released preliminary key findings based on the first year of data. So that's from February 2019 to February of 2020. So even in that short amount of time, they were able to recognize some of the same things that we have witnessed with our participants. And that has been a tremendous psychological shift. Instead of focusing on the day-to-day, it was focusing on how do we plan for the future. And our participants have been willing to also engage in goal setting and financial mentorship, which didn't quite take off initially because they were just trying to figure out what to do and what was going on. In addition to the financial support, our participants have been able to step back and look at ways to increase their long-term earning potential. So if that has been, instead of working 2 jobs, work 1 job and go to school, they have embraced those opportunities. So the full report from the Stockton Project is attached to this report for you to look at in depth. And that is work that, though the first year ended in February of 2020, it just got published this March. And this is kind of our North Star of how we are going to be working towards putting information together on our project. So it's a good preview for you for how things will materialize because we were able to model our evaluation tool after not only theirs, but some of the other projects that had started before us. So there's more analysis to come. And one of the easiest tools that we have is our surveys. And with the board's acceptance of the incentive programs that started in September, we were able to increase our numbers in August. But what those numbers don't tell you is how many also volunteered to send in emails, tell their stories, be available to us just to add the personal context that we've been looking for throughout the pilot. And what we have heard over and over again is their willingness to improve their own overall well-being, be that taking a step back, not working an extra shift, and actually spending time with their children or those that they are in charge of, because many of them are caretakers. That was a very compelling story for us of how they're looking out further beyond just what the data may show you. We know, and it was a little bit surprising to us that we had not only primarily women and Hispanic, we had many who were parents. What isn't captured in the data, but we heard through their personal stories, is how many of them aren't parents, but are responsible for caring for younger siblings who are also involved in the foster care system, and how by having this support, they were able to step into that role as caretakers. And the educational levels vary between our participants, but again, they use this as an opportunity to focus on their education. So we're hoping that as we continue to follow them after the pilot, we'll see those education levels also increase. And it's been just great to hear how they have shifted to having a resilient framework within themselves. They're looking at how to use their time, and I will turn it over to my partner, Sandhya, who will give you some details, which direct quotes from the participants.
Thank you, Melanie. Yeah, and on that previous slide, Melanie, if you don't mind just going back one slide to the slide you were on, I think it appears to have a positive impact, especially in the area of emotional well-being and decreased financial stress. So some of the points here in terms of reflecting on the survey from baseline to midpoint, some of the sources of stress went down: work-related stress, housing, family relationship, transport and communication, commute, likely because they were working from home. Interestingly, psychological distress increased by a lot, but that might just be in the context of the pandemic. And as Melanie said, life satisfaction and perceptions of resilience as measured by Likert scale items, those increased as well. Melanie, next slide, thank you. And we pulled out some qualitative comments to kind of ask, to point the success of the psychological and also material impacts of the program. So it sounded like this program was very beneficial in terms of actually providing some relief in day-to-day sustenance, and also psychologically made them feel better about themselves. Next slide, Melanie. The biggest increase, as you'd expect, was in the area of financial security. There was a decrease in perceptions of stress around their finances. We also asked them in an open-ended question how they intended to sustain themselves post basic income. And it was interesting to see that 63% said they'd actually used this money to pay off debt, they'd saved, and they felt that they were in a more stable place as a result of these cash infusions. And we have a couple quotes there. In terms of how they would continue to stay stable post-BIP, they felt they needed either an extra job, extra hours, a side gig, and that's how they would continue to make up the difference. And then in terms of, these are still subjective measures, but they said that their perceptions of credit score increased, and then also self-reported credit score went up by a few points. So these are all pluses. With housing, the picture is a little more mixed. While fewer reported being homeless, you'll see that the numbers in terms of couch surfing or being in temporary housing, that went up. And fewer participants said they were renting. And it might be that they moved back home with families to save on rent, like a lot of other young adults did. Does that cover all of the evaluation sections, Melanie? Yeah, and we'll have a similar evaluation at the end of the program, and then we'll be able to match up the data individually and do a pre, midpoint, and post snapshot of what the impact, self-reported impact of the program. Back to you, Melanie.
Thank you, Sandhya. And so what Sandhya said is, but what is important for us are what are the next steps? So one of the questions that we received from the board in September is how do we propose moving this forward based on the information that we have? And we have not only continued to hear from our participants, but we've heard from our community-based organizations who serve former foster youth of how they have also seen the change in our youth, because they are wanting to be a part of the solution. They want to make sure that the same support that they've received is available for those who are anxiously waiting to see what will happen. And so we plan to come to the board on September 25th with our proposal to extend the current cohort for 6 months. And that will bring us to 24 months. 24 months is on par with the national pilots that have happened and the Stockton project. And that is important for us because we want to make sure that as we move forward, we're doing this in the same manner in which the other pilots have been done, so our data is comparable. And really 2 years is the right amount of time to be measuring a life change within the youth. And also the state pilot the state pilot money that will become available is looking at 2-year pilots. So we're looking at kickstarting the county's next cohort. That would be a cohort of 50 TAY youth. We would be starting with the oldest, and we would start from the beginning identifying this as a 24-month program. We will at the same time be applying for state funding, and by the time the budget is getting finalized, we will know how much we're receiving from the state and how much larger the next cohort could potentially be. But we want to start with the oldest because we know that the priority for the state funding will be starting with the youngest of the transitional age youth. So we're hoping that this will bring us to meet in the middle for our transitional age youth. who have been waiting to see what the county will do next. We will still maintain that they have had a dependency case between the ages of 16 and 21. We will make sure that they're residing in our county full-time, because it's important for us to be able to access them so that we can continue to do the surveys and that we can also connect them with some of our other services. Our social services agency has had the same nervous feeling of how do we ensure we support them after the pilot ends. So we're looking at employment resources that we can be providing to them post-pilot. So it's important that they remain kind of here in our county. And we've flushed out a little bit more what that intake process would include. And for the second cohort, we would want to ensure that the youth know from the beginning that they should do the surveys because they also get the incentives. So we would be budgeting for the incentives moving forward and having them complete that first baseline survey before we have them sign up for the payments as a way to ensure we're getting a more robust set of data as we move forward.
Thank you both very,
Sorry, in closing, I just wanted to focus on 3 of the young women who have just been a tremendous example of how this infusion of support can stabilize their lives. They have developed not only a level of trust with us, but with one another and also with their peers. They have stepped forward, not only to become advocates for former foster youth, but to mentor those who are also in the program who have had a little bit more of a difficulties, just adjusting to what is going on. And it's not uncommon for them to advocate for the others in the program, for not only for themselves. And they've played an active role in testifying at the state for former foster youth and have willingly gone on public radio to counter some of the thoughts that the public may have that they're not working, they're just sitting at home, and shared the number of jobs that they have just to survive in our county. And they have been incredibly compelling. And because of the resourcefulness that they've demonstrated in helping each other, we know that as we move forward, one aspect we would like to add to the pilot is having a community worker who can help to connect them to resources and can help capture their stories on a peer level. So yes, they've become comfortable with us and they're sharing information with us, but we think we can add to the qualitative data by having a peer who they trust from the beginning of the program to give us a little bit more depth to the stories that they're sharing. And that concludes the presentation.
Thank you. Sorry, I jumped in there, Mel. Took a breath. I apologize. I'm going to see if there's anybody from the public who would like to weigh in on this item. I see none. I'm going to close the public hearing and go back to the board. You know, I want to take a chance to really dive into the report, and I really appreciate the information and appreciate what you'll be coming back with, because I think that is true that, you know, really being able to compare apples to apples, I think would be helpful. One request I would have is on the housing front. Those numbers are a little, they could be a little perplexing. And I think it would be important to better understand the choices that are available to folks, as well as the choices being made. And in particular, what's intriguing to me is that we saw a minor dip in homelessness. It's relatively minor, an increase in couch surfing. And what I'm presuming that means is that folks with a little bit of money are able to rent a room or literally a couch. And so if that's already in the report, I just didn't read it because it came late, but I don't know if that isn't in the report. I think that's an area that would be really important for us to dive into, because one of the things that we need to think about, again, as we're sustaining all of these programs that we're funding, is what of these programs have multiple outcomes, because the cost savings to us to giving someone money to manage themselves, to address their housing needs, if we're seeing some effectiveness there, that could be dramatic in terms of why we might want to fund one body of work over another, as an example. So I am really interested in that, given that the cost to us for people being homeless, we know what that is, and it's tremendous, and beyond the emotional and traumatic cost to that child or that young person. All right, Supervisor Ellenberg, did you have any thoughts or comments on this item?
Just very briefly, I really appreciated the report and the level of data that you're collecting. You touched on this, Melanie, but I think a really important component is going to be post-pilot. Where are these kids 2 years after the pilot? Are we having a sustaining impact, or are we providing an essential Band-Aid? I don't want to minimize the importance of the money while they are giving it, but it will be interesting over time, and it will certainly bolster the prioritization, I think, of the board to continue to fund this and to expand it. So thank you very much. The first results are encouraging overall.
Thank you both.
Thank
All
you.
right, with that, there's no action, but we look forward to seeing you very soon in front of the full board. So thank you for all that work. We'll now move on to item 12. This is the VASC report. And I believe this is Key, Betty, and Roberto. And I'm not sure who our lead person is. Is it Key and Betty or Roberto or?
Good morning, I am here.
Great. And who's leading us today?
That would be me, Cindy.
All right, welcome, Betty.
Thank you. Let me just get our slides up. Share. Hey, good morning, Chairperson Chavez, Vice Chair Ellenberg, and members of the Children, Seniors, and Families Committee. Today's Vietnamese American Service Center update will be provided by myself and Roberto Mendoza, Facilities and Fleet Capital Projects Manager. Today, we will go over the construction schedule, community engagement plan, the specifics of our soft opening and grand opening. And now I will turn the presentation over to Roberto.
Thank you, Betty. Good morning, everyone. Want to give you the update on construction and wish you happy holidays, everyone. So we have obtained a temporary certificate of occupancy allowing the staff and public to access floors 1 and 2. We got that temporary certificate on the 2nd of December. By the 13th, I believe, we had our first day of the soft opening with senior nutrition program. Betty will tell you probably more detail about that, but I'll just say that the third floor is currently limited to construction personnel. The key work to complete is we have some audiovisual equipment that is getting final programming and training, the building commissioning, which will ensure that all of the systems are functioning correctly, and building automation system, which will control all of the HVAC equipment. And we have some additional medical equipment that needs to be delivered and installed. We also have on the 3rd floor, we are going to start the tenant improvement activities shortly. We are a day or so away from getting the plans submitted for permitting, and we're getting the contractor pricing on the demolition portion of that, and the subsequent work. And what that entails is converting a room to a toddler toilet to support the supervised care function. So that would be adjacent to supervised care. Also, demarcating the public from staff areas, providing a staff break room that's solely for staff, and also relocating a lactation room for staff. Did I miss anything, Betty? Anything else you wanted to? All right. So as far as the construction timeline, we had our ribbon cutting ceremony on October 23rd. Occupancy began shortly after the 3rd of December. And Betty, you're looking for a grand opening to coincide with the Lunar New Year on February 6th. So then we'll continue with the tenant improvement, and we estimate that to conclude in the first week of April. Some images from the event. And this image on the right, these are the metal banners that just got installed.
So that's now. Next slide. View of the interior. So when you saw it in October, which I believe is the last time chairpersons saw the space, there might be a little more polished look to it now. Betty can attest. So there's our staircase on the right, fully completed. Multi-purpose room on the left. The clinical reception areas on the right. Next slide. And design team and the artists continue to work on putting their package together for permitting the light art installation. That's where that's at. I'll pass it on to Betty.
Thank you, Roberto. Dear committee members, 10 years after the first Vietnamese American Health Assessment was published, quickly followed by the Latino Hispanic Health Assessment, after 8 years of continuous and ongoing community engagement sessions, in 3 years since we first broke ground, and I have waited so long to say this, the Vietnamese American Service Center opened its doors for service this past Monday. Today marks our first week of operations. Backtracking a little bit, these are photos from our ribbon cutting celebration, which the committee and many of our attendees today were present at. This event was a community celebration, providing first look inside the center for the public. This was held immediately after we received notice of end of primary construction. And I want to acknowledge our county staff who volunteered their time, effort, and weekends to help us plan and throw this party that garnered 1,500 attendees. As noted, we opened our doors this past Monday. The first floor is fully operational with staff feverishly installing medical equipment on the second floor, with the last leg of construction to begin on the third floor. We have a team of navigators, community outreach specialists, program managers, and office specialists here all on deck serving our public. And I'm very proud to say that all of our staff are either bilingual in Vietnamese, Spanish, or Chinese. 100% of our public-facing staff are either bilingual coded in Vietnamese or bilingual coded in Spanish. The senior nutrition program has brought a very large clientele. It started on Monday along with the rest of the center. Our seniors reflect the diversity of our community. It's not just Vietnamese-speaking seniors who are coming to the center, but we also have Spanish-speaking and English-speaking seniors getting a hot meal at our site. The program served 100 meals on the first day, 125 meals on the second, 212 meals on the third, and we served 225 meals yesterday with plans for 230 meals today. In 2 weeks, we will start ballroom dancing, Tai Chi programming, and possibly ping pong for our seniors. We are awaiting the arrival of our ping pong tables to also add that activity. And these are activities that were requested or identified by our seniors during the community engagement sessions. We also have currently in our first floor lobby and rooms, a cultural community wellness program, peer support navigators from the Behavioral Health Services Department to provide patient navigation and behavioral health resources, services, referrals, and recommendations. We have healthcare eligibility determination and enrollment assistance happening in our lobby provided by Community Health Initiative. The Social Services Agency Department of Employment and Benefit Services has a station here in the front lobby providing CalFresh, CalWorks, Medi-Cal, general assistance, and refugee resettlement assistance and information. Our Community Health and Business Engagement team deployed from the COVID-19 Emergency Operations Center are on site to provide CalFresh application assistance, help schedule vaccination appointments, and a suite of COVID-19 support services for workers financially impacted by COVID-19. Our COVID-19 isolation quarantine support program is also here with emergency rental assistance programs, housing support, and food support. And with our public health department, we have scheduled our first COVID vaccination and booster clinic to take place next Thursday from 3 to 7 p.m. We'll be sending out the flyer for that shortly after this meeting today. During our self-opening period continues throughout January. We will be launching the following services in the start of the new year: behavioral health clinic, providing mild to moderate and some specialty services. Our Valley Medical Center patient navigation and appointment assistance will be on site to schedule appointments for patients, provide clarity as to what health services are available here, and assisting customers with enrollment into the Valley Health Plan to receive care here or anywhere else throughout the VMC network. This service is in anticipation of the opening of our clinic planned for March of 2022. This is our final slide and lists the services and resources planned for launch after our grand opening. Health services are targeted for February and March opening. The open collaborative space, mobile computer lab, food pantry, and homework center will launch shortly after completion of the 3rd floor construction. I want to end this presentation with deep, profound gratitude for our board leadership, Supervisor Chavez and Senator Cortese, former supervisor, for launching these efforts in 2013, for our county leadership, community leaders, the public health department for crafting the health assessments that frames our mission and service model, and to the army of staff from facilities and fleet, behavioral health services department, TSS, health and hospital systems, the CO division, security, DSJ, Office of Budget Analysis, Rodan Construction, the design team, ADAS architects, and so many more for making the center possible. The building is a hub of activity every single day, both public facing and behind the scenes. We are on day 5 of operations and are only going to get better. We get better every single day. We do look forward to having International Children's Assistance Network, to having Latinas Contra Cancer, to having our community partners on site to be able to provide family programming. For example, we're so excited to begin providing cancer patient navigation, advocacy, support groups, and which will start in January, along with a wig and bra boutique, all provided by our partner Latinas Contra Cancer. I want to point out that the survivor support groups will be conducted in Spanish and Vietnamese, separate workshops happening simultaneously, who will be brought together for a joint reception as a scheduled portion of their support group meeting. This is something that's launching at the Vietnamese American Service Center. It's a new program introduction by Latinas Contra Cancer, and we see that happening with a lot of our partners, where with this center and the resources we're able to provide here, we are working hand in hand with them to expand their services and resources and language capacity.
Betty, are you there now?
Yes, I'm reporting live from the Vietnamese American Service
All
Center.
right, that's awesome. And Betty, the actual opening is going to be on Tet, right?
Yes, so February 6th is our grand opening celebration / Lunar New Year. That was not planned on purpose. It just worked out that way. So I think it was meant to be. And so it's going to be that Sunday. It's going to be a big celebration. We look forward to seeing everybody here, and then followed by that Monday grand opening of full services at the VAS.
That's wonderful. Thank you. And congratulations to for everybody's work. And really everybody, Betty and Roberto, please share I know this was a labor of love for people. And I just saw it when I walked around and talked to people. It's just really tremendous. Just one request that I'd like to make is that this building sits right next to Renaissance Place. And I want to make sure that 3 bodies of work are complete before the end of, before we get to mid-January. And that is that the abode family services that are providing services at Renaissance Place, I want to make sure we're doing a specific tour for them so they see the facility. And I want to make sure that we're also doing a tour for all 3 shifts of Station 26 of the center and understand its hours and all of that. And part of the reason for that is that we have a very high, and then last thing is that we also want to make sure that we're doing tours and education for all of the folks who live in Renaissance Place. So I'd like them to have specific tours for the folks who live there after you've done tours for the staff, and then have the staff join the community. And it might require us to do, just because of the Omicron virus, to do to be part of their resident meetings that are online. But I want to make sure that every resident there knows what services are available next door, and that we have enough communication between the staffs, that people have exchanged numbers and all of that. And I don't know if any of that's happened already. If it has, that'd be great. I'd love to know that. But if it hasn't, mid-January is kind of the done date.
We are in communication, Cindy, and getting ready to schedule visits and tours for a number of the parties you just mentioned, and also some new names that I'll be sure to get started on. Thank you.
Okay, great. I really appreciate it. Thank you. And when we do the next report back, I'd like to know how those meetings went, because really what we're trying to figure out is how to address utilization. Renaissance Place has a high number of calls for service, both to, the fire department, and they've got really one of our biggest staffs there through our partnership with the boat. So better understanding what the service level needs to be for that to operate, and at its optimal capacity, both for Renaissance, but also, we have one of our most skilled facilities right next door, and it would be good if people could start getting their health care regularly there. So that's great. Thank you so much. I'm looking forward to TET, and we'll look forward to having you back to us at the January meeting for a verbal report on how all of these meetings are going. Does that sound okay to you, Supervisor Ellenberg? All right. Thanks, guys. Congratulations. We're now going to go to our verbal reports. We'll begin with our Chief Probation Officer. If Laura's still with us. I don't see her.
I am.
Oh, there you are. Great.
Thank you.
Thank you.
Great to see you guys. What a inspiring day it's been.
Yeah.
So yeah, we have a few things to talk about. We've got 2 trees at Christmas in the park. One was done by County Office of Education, and the other was done by our resident artist in Juvenile Hall for our art therapy program. So really encourage folks to look at those. They're really cool. We're launching the Secure Track program in Juvenile Hall. We're way down that path. We've got 6 youth committed at this point, a couple more in the pipelines. Super excited about the programming we've been able to set up in the partnership with behavioral health. And that's about it. Happy to answer any questions.
Thank you, Laura. And Susan?
Thanks, Laura, Chief Garnett. My staff regularly attends the Santa Clara County CBO and Juvenile Justice System Stakeholders meeting. And I know that at the last meeting, there was some discussion on what people are doing to bring some holiday cheer to youth in our care in custody. And I just want to thank the high schools, the Public Defender's Office, Make-A-Wish, and probably others for organizing gifts. And it's also my understanding that some of our youth in Secure Pathways don't want gifts for themselves, but for their siblings or their children. And I'm wondering, Chief Garnett, if it would be all right for us to share the request and the point person here.
Absolutely.
All right.
So let's have the point person be.
I believe it's Dolores Morales.
Yes,
yeah. But I just wanted to make sure that that was all right with you. And I know they're looking for gift cards for Target and for food and for gas. There are also wish lists for games and art supplies and sports gear and beauty and skincare and books. So anybody that is interested in helping, then we should reach out to Dolores.
Yes, Dolores Morales.
And Chief Garnett, if Dolores could send us today something that we can put out in our communication. We have our big newsletter that goes out this afternoon.
Okay.
It gets to thousands of people. So if we could get that and sent to Jason Benner in my office, we'll get that out as soon as we can.
Yes. And to Myra Flores in my office. Our newsletter is going out, I think, Monday morning.
Okay, I'll send it through council and send it to the.
Thank you so much.
Great,
thank you.
Thank you.
Thanks for a great meeting.
Yeah, thank you. I know. We work in a great place with really, really excellent people. So thank you for that. And including you, Chief Garnett. I'm a big fan. All right, item 15, our social services agency director is today is, I don't know. Deborah, welcome.
Good. Is this still morning? Good morning.
It's still
morning. 11:48. Chairperson Chavez and also Vice Chair Susan Ellenberg. Thank you so much for having us today. First of all, let me apologize. I was on earlier at 10, but my identifier wasn't working, so I was incognito of sorts. So apologize for that. Thank you so much for the comments that we made. Bob just wanted to share, have him share with you about the work that he and the other directors are doing around IHSS and really looking at the assessment process and looking at a variety of ways that they can conduct those assessments. Basically, the reason being is a lot of our clients have stable, non-changing kind of conditions, and while others have more acute. And so beginning to look at how they can redirect the resources to those that are more acute, and maybe look at a variety of ways of doing assessments with the others that are more stable. And the other thing is also around APS, because we know that's been an interest of this board, and we appreciate the support that you provide us around that. He and the other directors are looking at training programs, continuing the existing training, but also enhancing the training, because we realize that one, as we begin to look at those individuals 60 and older, there's some unique mental health needs and health needs that they have. And so they want to make sure the staff is prepared for that. And then also, last but not least, we all are aware of the lessons that we learned from CCR. And so he and the other directors are there looking at how they support their resource families, what kind of training and support do they need. And so they're beginning to look and explore, and you say, why are they exploring all this? Begin to make recommendations to CDSS around some policies and some practice changes. So just wanted to share that with you. And I'm open for any questions that you may have.
That's wonderful. Susan.
Deborah, thanks for your report. The same hard-hitting question for you that I did for Chief Garnett. Are there any holiday drives for clients of DFCS or the Department of Aging and Adult Services that folks who are so inclined can help?
Absolutely.
Bring a little cheer.
Yeah, absolutely. We have our angel tree for our seniors, and that allow folks to adopt a senior for Christmas and the holidays. And so that has been going on, but we also have a donation fund for seniors, and we can get that information and share it with you so your office can share it with others. The same thing, we have Adopt a Family for Department of Family and Children's Services for the holidays. And I know Daniel was on little, and Daniel is on now, and he can give more information where you adopt a family and they have a list of gifts for both the parents and the children. But also, we also have a donation fund for foster youth to help some of our transitioning and older youth transitioning out of care. And so we, in fact, are on the combined giving list for our foster youth. And so we encourage our partners and both community and our staff to support our foster youth.
Wonderful. If you could get those links and information to both of our offices as well, we'd be happy to support and share.
We will do that exactly. Thank you
very much,
so much.
Deborah.
Thank you so much, Deborah, and thank your whole team for the good work they do all year round. We appreciate them.
And we appreciate your support. Thank you so much. And we will let them know.
Thank you. Ignacio, you were going to bring us home.
Yes, thank you very much. Good morning. I actually have an update on some potentially exciting news in terms of funding related to the Department of Child Support Services. Child support directors statewide are working with our association, the Child Support Directors Association, on developing a funding proposal that will include additional funding, not only for counties that have been deemed historically underfunded, but more importantly, for counties like Santa Clara County to be able to receive for the first time a cost of living adjustment to our funding allocation that we receive from the state. As you all know, the state is seeing and projecting an unprecedented state budget surplus for the upcoming fiscal year. In our discussions with the California Department of Child Support Services and our association, it's been deemed that it's an appropriate time to be able to put together a proposal to hopefully request and get granted a 5.9% cost of living adjustment. We're working with the association, we're working with the State Department of Child Support Services on it, and we've already begun to reach out to state legislators just to educate them on the proposal that will be coming their way as part of this upcoming state budget development process. So as part of mid-year, we normally delete any vacant positions that we have in order to fund increased costs for the upcoming year. With a flat budget, it's what we have to do in order to pay for cost of living adjustments for our staff that are already negotiated. However, this year, we're holding vacant positions with the hope and anticipation that this budget proposal is approved And it would actually allow us to fill some of these much needed vacancies, some of which I know you all are familiar with, including caseworkers and potentially even an attorney position. So there'll be more to come on that. We have a meeting coming in January with our association and with the State Department to discuss more of the progress related to those proposals. But I'll definitely keep the committee informed, and I'll circle back and update you as we progress through that process. That's all I have to report today. I'm happy to take any questions you may have.
Ignacio, that's actually shocking news. That's not just good news. That's like, I mean, yeah, that's great. You know, again, I would just say to you and Danielle Christian and to Supervisor Ellenberg, again, because of her leadership role in CSAC, that whatever the talking points are we all need to be using, please let us know so we're all pushing together. That's just great news. Thank you.
Thank you. I definitely have a document I could forward to both of you as reference to be able to have that information when those potential discussions come forward.
Yeah, and I would send it to also to Miguel and Steve Preminger and Danielle Christian, because we should, like I said, all off the same song sheet. Thank you.
Thank you.
Again, I think on behalf of myself and Supervisor Ellenberg, we want to thank all of our staff for the amazing work you do year in and year out, and for all those attending who are also leaders in our community, protecting littles and folks who are most in need in our community. We are grateful to you. Happy last meeting of the Children's Family Seniors Committee. We will see you in the new year. Be well. Thanks all.
Recording stopped.